Welcome to today's Explainer. We're diving into a painful medical mystery hidden deep within the aging pelvis.
Imagine having excruciating pelvic pain after a minor fall, but standard imaging shows absolutely nothing wrong. Well, between 2002 and 2011, we actually saw a shocking threefold increase in these unseen fractures. These are sacral insufficiency fractures. They happen from something simple, like walking or tripping, not major crashes. Things like age, steroids, and radiation silently destroy bone density, leaving the sacrum super vulnerable to invisible cracks. Here's the catch. Standard X-rays miss most of these. You absolutely need a CT or MRI scan. So if there's persistent pain and immobility, but clear X-rays, that's a massive red flag demanding deeper investigation. Counterintuitively, putting an elderly patient on bed rest is literally one of the worst things you can do.
You've got to get them moving. Early immobilization with walking aids is the ultimate goal to prevent muscle loss. We tackle this by combining careful pain management with vital anti-osteoporosis meds so the fracture doesn't worsen. But wait, what if they simply can't walk after a few days? That signals an unstable fracture. For those unstable breaks, physical therapy just won't cut it. Percutaneous surgical fixation becomes the highly recommended path. One option is sacroplasty. It's a minimally invasive cement injection, but it carries a pretty terrifying risk. The cement can actually leak out of the bone. This complication can literally crush the surrounding nerves. Because of those scary cement risks, surgeons often prefer stabilizing the pelvis using large percutaneous screws instead. But there's a catch. Gripping brittle osteoporotic bone is like putting a screw into drywall. It easily loosens. To fight that, surgeons now use specialized 3D-printed titanium implants. The bone can actually grow right into them. In severe cases, like a U-type fracture, the entire spine can essentially disconnect and fold completely forward. Amazingly, just positioning the patient face down during surgery can dramatically straighten that spinal deformity before they fix it. For these extreme breaks, surgeons build a rigid triangular anchor of screws connecting the spine directly to the pelvis. Ultimately, the whole point of these intense surgeries is getting elderly patients out of bed and walking immediately. So as we age, what crazy 3D printed technologies will they invent next to fix fractures we can't even see?